Hello, my name is Lloyd F. Reese. I'm your host, and I'd like to welcome you to Lloyd's Perspectives. Catastrophic diseases have been detrimental towards mankind since almost our existence on this earth. Prostate cancer is a devastating disease that's affecting thousands and thousands of lives. Today's topic is going to be prostate cancer, education, and screening. We have in our studio as our guest Dr. Fred D. Parrott, who is the founder and director of the Real Men's Cook Foundation. Dr. Parrott, welcome to the show.
Thank you very much, Lloyd, and thank you for having the Real Men Cook Foundation Center for Early Detection of Prostate Cancer involved in this production. One American man is diagnosed with prostate cancer every 3 minutes. One American man dies of prostate cancer every 13 minutes, and 15% of these men are African American men. And as you know, prostate cancer is epidemic in the African American community.
Now, the Real Men's Cook Foundation, the Center for Early Disease of Prostate Cancer, has been in existence for 10 years.
It's been in existence for approximately 10 years.
And Dr. Parrott, can you share with our viewers, it's such a large organization, and you're reaching out to the various communities in Los Angeles. What is prostate education and screening all about?
Prostate cancer education and the Real Men Cook Foundation is primarily in bringing education and awareness about prostate cancer to the inner city minority community.
Now, is there a problem with the indigent male being tested, Dr. Parrott, because the numbers are so low?
Yeah, when we first got started, it was a problem, but we have partners with community organization, with political and religious organization, and awareness has increased almost over 1,000% as of today. Now, there is still, however, a big problem.
Dr. Parrott, the Real Men's Cook Foundation for Center for the Early Detection of Prostate Cancer, it's a large foundation, and you partnership with a lot of different individuals. What I want to know is, how did you go about bringing awareness and getting those people on board with you?
Dr. Ila Skinner was my surgeon. President of USC Norris Cancer Hospital came up to see me, and she was not only a friend but was a patient. And I told her, I said, you know, Norris should become involved into the minority community. This is a devastating disease. And I said, why don't you see if we can start an educational program in the African American community? She went back to her people, came back and said, let's do it. In the meantime, Dr. Skinner knew nothing about it, so when she made rounds, I said, the president of USC Norris Cancer Hospital was by to see me, and and the Norris Cancer Center would like to do a educational program in the African American community. So she went to her chairman of the department, and he came back and said, we think it's a fantastic idea to do this.
Now, speaking of Dr. Skinner and her involvement with the USC Norris Comprehensive Cancer Center and Hospital, we went on location and we interviewed Dr. Skinner just to see what her world is about. And I want to share with our viewers how wonderful that interview was with Dr. Skinner. Do you feel that there's any particular reason why men are afraid to have themselves tested, Dr. Skinner?
People have actually looked into that from a research standpoint, and I think there's 3 reasons. One is that they're afraid of the actual test, which includes usually doing an examination of the prostate, which is a little bit uncomfortable. I think the biggest reason that people don't get tested is either they don't know about it or they're afraid of the answer. And what's happened over the last 10 years as screening has become more available is that we're catching prostate cancers at an earlier stage when it's still curable.
So should men be tested earlier than 40 years old, or should 40 years be the starting?
No, 40 is definitely early enough. Dramatic potential to reach out, I think, especially to underserved men, minority men who are not necessarily getting the same kind of preventive care that some of the people with more access to care have. I think it's really got a tremendous potential. Especially, I think, as a white woman, I certainly have not had the opportunity that I've had working with Dr. Parrott to interact with the African American community in Los Angeles, and we've now, I think we're going on 10 years, and it's really been a tremendous experience for me.
So what we did was we went on location and spoke to an individual, and I want to share with our viewers what this person had to say. Ms. McDuffie, where are you from?
I'm from Tampa, Florida originally, but I've been living in Los Angeles since 1982.
Now, Mr. McDuffie, are you familiar with prostate cancer education and screening?
The only thing I know about prostate cancer is that my daddy had it, and as far as the screening, no, I don't know about screening.
Do you know what the prostate is, Mr. McDuffie?
I know the prostate has something to do with the urinary tract, and it's somewhere but right below the stomach. That's all I know.
Now, Mr. McDuffie, do you know what a urologist is and what he does?
A urologist?
Yes.
Well, judging from the word uro, it probably has something to do with the urinary tract. But other than that, I can't give any specificities about it, you know.
Now, Mr. McDuffie, are you aware that there are 3 methods of testing to detect prostate cancer?
Now, as a matter of fact, I don't even know the first one, so no, I don't.
So, Mr. McDuffie, now that you've shared this information with us, in your own personal words, what do you feel we can do to get more men tested for this disease?
Well, first of all, we need to be made aware of how serious the disease is in terms of prostate cancer, and we need to be made aware of what will happen if we don't take some kind of action immediately. So things like what you're doing right now, you know, just finding out about it and letting other people know about it. You know, the word needs to get around, because I don't think many of us are taking it real seriously. You know, it's just something that we hear about.
But you've also partnership with MDs and urologists, and you've got a very, 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 very wonderful urologist and medical doctor working. He's a senior consultant for the Rubens Cook Foundation, Dr. Thomas Johnson. What are your thoughts on Dr. Thomas Johnson?
I think Dr. Johnson is an outstanding urologist, and he's an advocate for prostate cancer, and he has done a tremendous amount of work in the community to bring and increase awareness about prostate cancer and the importance of early detection of prostate cancer to save the lives of men.
Now, I had an interesting conversation with Dr. Johnson in his office, and what he did was sort of took the time to explain what the prostate is. So what I want to do is share with our viewers the wonderful interview that we had with Dr. Johnson, talking about the importance of the prostate cancer and how our men should be more aware of what's going on. So I'm going to share that with our viewers right now. Can you share with our viewers, what is the prostate?
Well, the prostate gland is part of the male sex apparatus. It's situated just outside the urinary bladder, and it encircles or encompasses the urethra, or the tube where the urine goes through. So the anatomy of it explains part of the problems that we have with it when it comes to medical issues. But basically, the prostate gland provides most of the ejaculate during sexual intercourse. When men have an orgasm, and the seminal emissions, or the fluid that's produced, most of that fluid, over 95% of it, comes from the prostate gland and the 2 organs associated beside it called the seminal vesicles.
You know, what are the diagnostic testing that you would prescribe for a man that might have prostate cancer, or you might think that he has prostate cancer?
Basically, there are 3 examinations that we use to try to identify men who may have prostate cancer. The first is the PSA, which is the blood test, and as I previously stated, it's only been around for about 15-20 years. Digital rectal examination is the thing that frightens most men away from the doctor's offices. That is the examination of the prostate by the doctor with an examining finger. Now, there's the third and probably a little bit more complicated test that we use for prostate cancer, and that is the prostate ultrasound, which is an X-ray test. That test is performed when we suspect there might be a problem based on either the PSA or the rectal examination.